Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, urgent care, affiliated with Henry Ford Health, St. Joe, Oakland, and Boomer. The theme of my talk today is about the allergies. Allergies in general, and specifically, I am going to focus more on the seasonal allergies that we are all going through. So, what is seasonal allergies? Spring allergies, winter allergies, they affect millions of children and adults worldwide. The seasonal allergies include rhinitis, food allergies, and asthma. And over the decade, there has been more and more incidence of this kind of allergy. Why? Because of increased pollen count, dietary factors, and also the immune system. So, from a pediatrics perspective, the early recognition and the modern treatments I'm going to go through. So, in order to improve ourselves against this allergy, the 2026 year have brought important advances in allergy care, including the targeted biologic therapies, improved prevention strategies, and treatments aimed to modify the immune system. So now, before I go through the recent advances, I just want to share with you the first line treatment of seasonal allergies when the patient come to emergency room, and if you get a phone call that my child is having allergics, what do you do? First of all, we advise over the counter antihistamine, which includes cetirizine, loratadine, and fluoxetine. Sometimes sometimes intranasal steroid spray also helps, because what it does, it reduces the edema. So the three essential steps in allergy emergency care are: assess the reaction, recognize the symptoms. If it is acute not breathing, then of course definitely they need to go to the emergency room. If they have an inhaler, then that helps. So most important, the three plans include: assess the reaction, recognize symptoms early, maintain the airway breathing, and epinephrine. So why we are getting more and more allergic symptoms? These are due to the fact that there is environment, pollution, and climate change. There is increased pollen season, and the indoor allergies are mostly due to the dust, mite, and the molds. Reduced immune resilience, like with the aging, lifestyle, and the dietary changes. So, what are the major advances in allergy treatment? During the year 2024 and 2026, biologic therapy, a major breakthrough. What are the biologics? They are the new class of medication derived from the living cells that specifically target the immune pathway. And in my next couple of slides that I will show it to you. I will talk in details about this. So now those are the medications. The new asthma and the allergy medication, certain of them are there. Includes the tessifier biologic injections that target the airway inflammation, the air supra, that is a combination of the rescue inhalers. And the combination of the rescue inhaler is used as the bronchodilator plus steroid, and this helps in sudden reduction of the of the edema in the air passage so somebody can breathe properly. And then targeted monoclonal antibody therapies. This is ongoing research going on. So, what are the advances in allergy vaccine? The advances immunotherapy include it aims to retrain the immune system. The current approach includes subcutaneous allergy shots, called the allergy shots, sublingual immunotherapy tablets, early research into the peptide based and mRNA allergy vaccines. So those are the new trends that I'm going to go more in details. Right now, I just want to share with you what are the food allergens, what are the food that triggers allergy in all age group. Milk, egg, fish, shellfish, tree nuts, peanuts, wheat, soya bean. They have also documented the fact that vitamin D and allergy. Studies suggest infants who are with vitamin deficiency with autoimmune disease, they develop food allergies, especially the egg allergy from vitamin D. Other low factors include autoimmune diseases like rheumatoid arthritis, cystic lupus, and multiple sclerosis. There is a combination with the histamine release and the autoimmune disease that I'm going to share with you. So autoimmune conditions with immune dysregulation, they include lupus, rheumatoid arthritis, multiple sclerosis, psoriasis. So all these conditions, they precipitate to severe allergic reaction and precipitate attack of asthma. And then I'm going to talk about the acute asthma attack. Before that, I want to share with you the mast cell activation syndrome. The mast cells activation syndrome is characterized by excess release of the inflammatory mediators, mast cells, and that cause hives, wheezing, itching. So those are the things. And from the pediatric perspective, the emerging treatment in 2026 includes precision biologic therapy, target monoclonal antibodies, anti-inflammatory that relieves the symptoms of the bronchial spasm and the asthma, and personalized care. So now I'm going to talk to you in detail. I have a couple of slides that I have prepared about the new biologics treatment for the asthma. Can I have the first slide, please? So what is asthma attack? Asthma, what happens, during an acute asthma attack, suddenly you start wheezing. The airway doesn't go through the lungs, and it's the first of all you can see that there is an acute asthmatic attack. You can see that this is the structure of the airway, like how air goes through the mouth to the pharynx, the trachea, bronchioles, and the bronchiole. If there is a normal airway on one side and the other slide, I have given a picture of the air, a picture structure of a asthmatic lungs, how it is. There is a complete constriction of the bronchioles and the tracheal mucosa due to edema. Thick mucus has clogged it, and so there is no air exchange. Hence, the person has an acute asthmatic attacks. Second slide, please. So now this one, I made it very simple for for the viewers to see, illustrate, what are the symptoms of seasonal allergies that you start getting it like in the beginning of the end of this winter, beginning of the summer, late late spring and the summers. So these are the symptoms: sneezing, running nose, itchy eyes, very common headaches, cough, congestion, and there's a dry cough. These are the symptoms, manifestations of allergic symptoms. So now, the third slide, please. Now I'm going to go through the biologics for the severe asthma. What is new? What are the new trends in the management of asthma in year 2026? Lot of emphasis has been put about the immunotherapy, about the biologic. The targeted injected medication for asthma, they are known as biologics, and what they do is they treat the severe uncontrolled asthma. How do they do that? They target the specific immune system pathway. Through the immune system pathway, this medication, they relieve the symptoms of the acute wheezing attacks. So when inhalers, so now there are the targeted injectable medication, like I said, biologic severe asthma, and the most common medication include is here Xolair or omalgesium, the classic biologic. What do? They bind to the IgE, and IgE is responsible for liberation of mast cells causing asthma. So these are so these are they bind to IgE and they prevent it from triggering the mast cells area. We want to protect that area of the mast cells because mast cells is the one that produces histamine. These are antihistamine. Another medication, Dupixent, targets the receptors of IL-4 and IL-13, highly effective. Type 2. I don't want to go through all the details about these drugs being used because in my bibliography I have included all of them. Basically, I want to focus on what is the commonly used medication. Tezspire, that is tezepelum, another. This is a new upstream biologic and it blocks the TSLP, which is a molecule that is released by the lungs lining. So in other words, to make the story simple, the lungs lining produces this agent that causes the symptoms, and they block it, the molecule released by the lung lining, because it acts so early in the inflammation chain. It works for a broad range of asthma attack. In other one, this is more like an anti-inflammatory agent. What are the recent trends in the therapy? Early intervention, very, very important. There is a growing trend towards using biologics early in childhood. Why do you do that early in childhood? To prevent the airway remodeling, such as it prevents the permanent scarring of the lung. The earlier you use this, the better it is the prognosis for these children when they grow. So it is also called the atopic mark, the progression from eczema to food allergies to asthma. So this is what it is. First you develop food allergies, eczema, and then the asthma. And then second factor is the shared decision making Because these are expensive injectable, pediatricians are focusing on the precise medicine that they're using blood test, check the eosinophil count and the nitrous oxide to prove a child will actually benefit from starting the treatment. Food allergies breakthrough, very important. A major recent trend is FDA approval of Xolair for food allergies. This is now used to help children tolerate accidental exposure to multiple food allergies like peanuts, dairy, significantly lowers the risk of the anaphylaxis. Home administration. Transitioning from clinical based infusion to at home pre filled pens are available for the treatment of the acute episodes of asthma. So, now what is the 4-4 rule for asthma? And this is a very interesting fact that I noticed in one of the journals that came out from Australia. The 4-4-4 rule for asthma, it is an emergency first aid procedure used during an acute attack to manage the symptoms until the help arrives. What it says, it initially you administer 4 puffs of the relief inhaler, and I'm sure everybody with the asthma or the history of asthma, severe allergy have those inhalers at home. So you use 4 puffs, one at a time, and then wait for 4 minutes, and then repeat the progress if there is no improvement. If the breathing does not return to normal, repeat the 4 puffs every 4 minutes until the emergency services arise. So what are so in I haven't gone into the details about the immunization series, and that I will discuss with you in my next series. But what are the how do you prevent the attack? And before that, I like to mention about the four asthma emergency step. Step one, you sit the patient upright, calm them. Step two, administer 4 separate puffs of blue-gray reliever inhaler, 1 puff at a time and 4 times. Step three, wait for 4 minutes. Step four, if breathing does not return to normal, you repeat 4 puffs every 4 minutes. And I wanted to mention about the epinephrine. The epinephrine, in case if somebody has an acute asthma attacks, the epinephrine is available now. The epinephrine is also available like a sublingual instead of the injection. The small dose of the epinephrine can be put under the tongue to relieve the acute symptoms. So those are the real treatments, emergency treatments of the asthma. So how do? You have to prevent. What are the tips to prevent seasonal allergies? So according to this diagram, limit the outdoor activity depending upon what you are allergic to. Always use air purifier. Reduce the exposure to triggers like pollens, dust, molds, and all, and maintain a good hygiene. Monitor the signs of the asthma, what we mentioned to you before. Follow a healthy diet. And lastly, avoid self medication, like do not want to medicate yourself. And like I said, the references have been given in the back of the page, And anybody wants to know more in details about the recent advances in the treatment of asthma, they can look through those bibliography. And this was my second segment about treatment of the seasonal allergies, the breathing difficulties, and asthma. And now, during my next presentation, I will focus more about the vaccines that have come up in the market to reduce the symptoms and reduce the attacks of asthma. So, in summary, I have described to you from the pediatrics perspective the treatment of the seasonal allergies and the acute asthmatic attacks. And also, I mentioned about the recent advances in the allergy treatment. I like everybody, all the individuals, whether they are child or adult, to be safe, whether they are at the school or at home mowing the grass or getting exposed to the pollen, to wear protective mask also. The mask is very important figure. And children, those with a history of asthma, they should always carry the air puffs inhaler with them in their school bag. I like to thank our viewers for listening to me on this podcast about the recent trends in management of seasonal allergies and asthma. And and until I see you again, hope everybody have a safe summer and early fall. Like to thank our producer, camera people, for organizing these slides. And until I see you again, I want to have, like I said before, have a safe spring and summer. Thank you again.